Based on international experience, around 14% of coronavirus cases are classified as severe, and another 5% are critical. This means that while this 20% of patients will require hospital care, 5% of these will require intensive care, including artificial ventilation. This may seem like a small percentage, but New South Wales Health is preparing for the virus to infect 20% of the state, which would mean 256,370 hospitalizations. This is well beyond the roughly 160,000 people admitted to the ICU on average each year. Keep in mind that this is a modest estimate. German Chancellor Angela Merkel warned the virus could infect up to 70% of Germans. If this happened, over 800,000 people could be admitted to the ICU over the course of the next year, and over 3 million Australians could require hospitalisation.
And in that case, ICU physicians will be faced with some very difficult decisions.
Currently, Australia has just over 2,220 ICU beds, which equates to around 8.9 ICU beds per 100,000 people. A coronavirus patient in ICU will require a bed for around 10 days, which is already longer than the 4 days average stay for other causes. If all current ICU beds were devoted solely to coronavirus patients, we would run out of beds by early April. This is assuming the virus maintains its current rate of infection. But of course, regular patients who would normally need ICU care won't disappear with coronavirus. Australia will be shortly heading into flu season, which will place extra pressure on an already strained system.
With immediate expansion, repurposing of other ventilator machines, including anaesthetic machines, and use of the private sector, we can expand to 4,400.
To ramp up our ICU capacity, New South Wales Health says it is doubling the number of ICU beds, but this comes with another challenge. Each ICU bed is monitored by one nurse around the clock, but this means the equivalent of 5 full-time registered nurses across 8-hour shifts, 24 hours a day, 7 days a week. To maintain the same quality of care, doubling the number of ICU beds would require finding another 10,000 intensive care nurses. Almost half of intensive care nurses hold postgraduate qualifications in critical care nursing, and there are fears that Australia does not have enough specially trained ICU nurses to quickly double the workforce. While there are great efforts to stock up supplies and fast-track training and development to increase Australia's ICU capacity, the best thing we can do right now is to slow the spread of the virus. If 80% of people comply with social distancing guidelines, we could reduce ICU demand by up to 69%.